Welcome to Talk 1260 KTRC. You're listening to Western Medicine, the Humanity Behind the Vanity. This is Dr. Daniel Ronel. I'm a board-certified plastic surgeon, and I'm here with my wife, Betsy Ronel. We're going to talk about the realities behind plastic surgery.
Yes, so we have a very interesting show today. First, I'll tell you, we have our guest, a very wonderful person. She's the president of the board of the Espanola Animal Shelter, which is first and foremost in my mind. But on a real note, she owns her own aesthetic studio. She's an esthetician, a facialist. I think she's also a registered nurse.
Yes.
And her business is called Aesthetics, and her name is Jill Jenkins. She's not only profoundly experienced, she's profoundly gorgeous. She's taken. But anyway, she's awesome. So she's going to be our guest of the day. We have a tip from Tess DeGange, our
reflexologist.
Yes, whatever she is.
Okay.
Good old Tess. And then, okay, Daniel clearly wants to get onto his topic.
No.
Brachioplasties, which is...
Oh, okay.
Get into it, man.
All right. I've done two this week. It
But
seems
wait,
to be
let's
that
just say
people,
one quick thing.
Yes.
We are sponsored by
Yes.
iFlow.
Generously sponsored by iFlow, the makers of the Pain Buster, Anki Pain Buster, and Artifil, Suniva Medical, who makes Artifil.
Yeah,
Thank
awesome.
you very much for
Okay.
your generous support. Anyway,
Yes.
so just for some reason, a lot of people are coming in now wanting to get their upper arms, their arms tucked.
Women
And
all are
that's-
familiar with this.
Right, and
It's,
so thank you.
Chicken flap. Sorry.
Yeah, some people call them bat wings,
Right.
and
Oprah has a funny phrase for them. I forget what it is though.
Oh.
Okay. Anyway.
you know, and they and that procedure is called a brachioplasty, B-R-A-C-H-I-O, from the Greek word bracha or brachio, which means
Right.
arm.
Right.
So anyway, there's a couple different ways to do it, and what's important is to find out what exactly the patient wants. There's the minimal incision brachioplasty, which one of my professors, Dr. Larry Reed in New York, he's one of the editors, by the way, of New Beauty.
Yes, I
I
know
love
that.
him. He's awesome. So he sort of is a proponent for the minimal incision brachioplasty, which is just an
I would
incision.
be too, man.
Yeah, it's just an incision for those of you watching us on YouTube. I'm lifting up the arm. That's in the armpit.
Okay, you also put breast implants that way as well.
Yes.
That saved in mind. Okay.
Yes, yes. It's
And incision disappears beautifully over time.
for brachioplasty, the incision's much bigger than for
Oh.
breast augmentation.
Oh. How
But
long is the incision?
It's really from one end of the armpit all the way to the other, and
Yeah,
one of the nice
still.
things is it cuts out most of the sweat glands.
Oh,
So,
everyone
yeah,
likes
one of
that.
the benefits is
Yeah.
that you don't really have to put that much deodorant on afterwards.
Wow.
Everybody's different.
Okay.
But that is just for the upper third of the upper arm. It does not help
The part above the
the
elbow.
part right above the elbow, right? So it's for, well, usually for people who are don't have such a big excess arm
Yeah,
skin.
this is my question. How do you break it down? I mean, I saw Courtney Cox on that funny show, Cougar Town.
Yeah.
She is stick thin with no body fat.
Right.
And she even, no offense, Courtney Cox, you're awesome, but facts are facts. You do have a little bit of a
Okay.
chicken flap there. We all do. I have one,
Right.
Oprah has one, obese people have them. I
And
mean,
skinny people are.
exactly.
Right.
It doesn't seem, that's why I mentioned Courtney Cox, because she's
Right.
stick thin with no body fat. Doesn't seem to matter how much fat you have, you still
Right.
have them. So who gets what kind of incision?
So if you have a nice tight skin, if you're young, for example, you would be somebody like that. Liposuction is a good.
I've been asking you for that for months.
Okay, well, that's a good way to do it.
Shoemakers'
If
children
you-
go without no shoes.
If
Mhm,
you've got
okay.
extra skin, you have to cut it out. But if you've got skin that's going to contract in, and you just have some excess upper arm fat, for example, you can do liposuction. Usually, though, liposuction is not a great answer because it's really a skin problem, not so much a fat problem. So
For
to see
liposuction, where's the incision made?
at the elbow, just
Okay.
underneath at the elbow.
And that gets the whole upper arm up to the pit?
Yeah, sometimes you also put an incision in the armpit itself. Because
Okay.
with lipo, you always want to attack the fat from two different
Right.
directions. To see if you're a candidate for the minimal incision, all you do is you just put your fingers in your armpit and you pull up the skin a little, right? You see if that's enough.
It is chicken
You
flaps.
just see if it's enough. But most of the time, people who come in for the surgery need the traditional brachioplasty, and that's an incision from the armpit all the way down to the elbow, and it's a big, ugly red incision for a long time.
But
And
it goes away in time.
Usually it does, but I always tell people this incision takes longer to heal, longer to fade, And it usually heals fine. I just saw a lady today that I did a few months ago, and her incisions are healing beautifully well, and they're thin, pencil thin. However, it just takes a long time.
But that's
to get
rare.
there.
I mean, even I, just as a regular person, not as your wife, have seen women who have had these things.
Right.
They can be a really big, clumsy scar,
Mhm.
and a lumpy one.
Yeah, it just
forever.
takes a long time to fade, and you really need a lot of the alternative stuff to
Right.
help it, and also silicone tapes, that sort of thing. However, most people are so happy to trade a
Yeah,
scar
I was just
for
gonna say
the massive extra stuff. In fact, people who have had massive weight loss, who've had like a gastric bypass or a band, they're delighted
Yeah.
with the results. And it also helps function. I mean, some people who are golfers or tennis players, they say that these get in the way.
Of course.
The operation is pretty easy to do. I still like to do it in the operating room. I don't like to do it in the office. I think that's too much.
Are you fully out for this?
Yeah, I like to put people fully out. I suppose if you really needed just IV anesthesia, that would be fine. You know, there's something called total IV anesthesia, TIVA, which is fine. But the way the anesthesiologists put you to sleep now, it's really not that big a deal.
Right.
It's a very light general anesthesia.
How long does the procedure take?
It takes about an hour and a half.
For both arms?
Mhm.
Not bad.
Yeah, it depends how much you have to cut off. I have some patients that ask me to go all the way down to the wrist because they've got extra skin in their forearm too.
Are you fat?
No,
Massive weight loss?
No, they're usually just skinny. The two I've done are just older women that are thin, and they've lost a lot of their fat, so they have extra skin in their forearm.
But I mean, is it really noticeable to someone else, or
Yeah.
is it just them? Oh,
No, it is.
just a little deformity almost.
It's not that bad, but you know, it's noticeable. They like to wear thin, long-sleeved gowns, and they feel much better when they've had that
I
cut
mean,
off.
I've seen women like that, but they're
Mhm.
usually chunky.
Yeah, no.
You got any complications from this?
What can happen is around the elbow there's a big confluence of blood vessels and nerves, and if there, the surgeon has to be very careful because if you damage too many, the arm can stay swollen for a long time. And even if that happens, the swelling in the arm, the blood vessels tend to recanalize. They find them, they find a way to rework themselves. But swelling can be a long one, and there's a lot of very funny sensations that can happen. It's kind of like hitting your funny bone.
Right, I was going to ask you, any
Yeah.
numbness, permanent numbness ever in the fingers?
You can always have permanent numbness anywhere. The
Right,
chance of that
because
happening.
it does happen to
Yeah,
facelifts and stuff.
but the chance of that happening is pretty low. If what's nice about a brachioplasty is everything is wide open, so you can actually see where you're cutting. So.
Wait, question.
Okay.
Okay, so what's their life like? What's their mobility? Right, what's the mobility limitation during recovery?
It's not that bad. It doesn't hurt that much. After, I would say for 2 or 3 days, they shouldn't be lifting their hands over their head, to brush their hair. But they can brush their teeth, right away the next day. Everybody's different. Some people are in more pain than others. I'd say getting back to activities of daily living will take 10 days.
What if you're an
On average.
active, athletic person like a tennis
It
player?
takes a little longer.
Okay,
Right.
interesting. All right.
Oh, we've got to wrap things up. You've been listening to Talk 1260 KTRC, Western Medicine. We'll be right back with a tip from Testa Ganj.